Hi, I'm Katherine Anderson, reporting for Daily Bulletin. I'm talking with Dr. Jade Iwasaka-Neder from Brigham and Women's Hospital. Dr. Neder is sharing key learnings from the RSNA 2025 session, Radiological Insights into the Intersection of Intimate Partner Violence and Opioid Use Disorder. Thank you for joining me today. Dr. Neder, what prompted you to study the intersection of intimate partner violence and opioid use disorder?
Actually, this is an initiative that goes much beyond me. I'm part of a lab called TIRIC. It's led by Dr. Bharti Kurana. And the main focus of this lab is searching intimate partner violence, also elderly violence. And we are seeing several different co-occurrences that can lead to intimate partner violence, or that can give us a clue of how to identify these patients that did not disclose the IPV yet.
Yes, and your research actually found distinct injury patterns that potentially signal intimate partner abuse and opioid use. So how might this knowledge change the way radiologists interpret or flag certain findings in their daily practice?
Exactly. So basically, we are going to see what are different findings, injury patterns, or characteristics in the history provided by the patient that we could use to make a network that would help us identify this intimate partner violence even in patients that did not disclose yet. So how this can change things for radiologists. The idea is having all these findings correlated by a computing system that would give us more information to then flag the studies. Oh, this patient has a high chance of having intimate partner violence. So with that information, you can then triage the patient. Does this patient require more attention, social work? Does this patient need psychological assistance? So that's how this can help the patient, and also use the expertise from the radiologist to do that.
Mm-hmm. So you see radiologists contributing to earlier detection or intervention in these cases, correct?
Exactly, yes. That's something that we are not used to, because a radiologist used to be kind of on the back of the work. You just see the imaging and you give the finding for the other physician that is also assisting with the patient. But with this type of information that we can gather from the reports, and this is a unique window of opportunity, the radiologist can really make a difference in if this patient is going to get a diagnosis, and many times save the patient from a much worse outcome.
Well, thank you so much for your time today. For more information about the study, look for this RSNA 2025 session on demand at rsna.org/meetingcentral. And as always, you can find more radiology news at rsna.org/bulletin.
Thanks so much for having me.